Today we will be bandaging a left arm for lymphedema management. Gather all of your supplies, which includes lotion, short stretch bandages, padding, finger gauze, and painter or masking tape to secure the wrapping. Apply lotion to the affected limb in preparation for bandaging. Next, we will take our stockinette and we will apply it to the affected arm. Be sure to cut a hole for the thumb and to have at least 2 inches of extra material near the armpit to cover the bandages later. Smooth out any wrinkles you may have in your stockinette. Fold the stockinette back up the wrist so that we can apply 4 centimeter gauze bandage to each finger. This is very important, especially if you have swelling in the fingers. Start by loosely wrapping the gauze around the wrist, coming down to the thumb. Apply the gauze in 2 to 3 layers for each finger, leaving as little skin showing as possible. There should only be skin shown on the palm of the hand and in between the fingers. You may need to use 2 or 3 gauze bandages depending on the level of swelling. Continue by wrapping each finger individually with circular turns coming from the top of the hand, maintaining a slight pull on the bandage. End your gauze bandage on the wrist. Pull your stockinette back down over the gauze bandage and put the thumb through the loop. Next, we will apply our padding bandage starting at the wrist and then to the hand and back to the wrist. You can gently fold the padded bandage as you go between the thumb and the palm of the hand. Continue to wrap up the arm until you get to the elbow. When you get to the elbow, take a piece of fabric and fold it into the crease of the elbow and continue wrapping up towards the armpit. You may need 1 or 2 rolls of padding bandages to maintain a cylindrical shape of the limb. Starting with your 6 centimeter short stretch bandage, we start at the wrist with moderate tension. Cover the entire hand, including the knuckles. Apply several circular turns around the hand, keeping the fingers open and extended. You may come across the knuckles anywhere from 2 to 4 times, depending on the amount of swelling. Continue the bandage to the forearm with the remaining bandage. Apply a small piece of tape to hold your bandage in place. Next, make a fist and place it on a firm surface and take your 8 centimeter short stretch bandage and start again at the wrist. We want the roll of bandage to fall away into our hands. Cover the entire forearm with the second bandage, making sure to keep your fist tight. The bandage should overlap about 2/3. When you come to the elbow, cover the elbow with a loose figure 8 crisscross turn one time, and then continue to wrap in circular motions up the arm with moderate tension. Try your best to keep your tension even throughout your bandaging. Again, apply a small amount of tape to hold the bandage in place. Next, take your 10 centimeter short stretch bandage and start where there is a soft give in your wrapping. This may be at the wrist or the lower forearm. Proceed with wrapping the 10 centimeter short stretch bandage around the arm in circular motions to bandage as much of the upper arm as possible. Be sure to alternate the direction of each set of bandages to ensure even compression throughout. Additional compression may be achieved by applying another 10 centimeter or 12 centimeter short stretch bandage if needed. Make sure that the finished bandage decreases in pressure from hand to the upper arm. Apply a final seal of tape to hold the bandages in place. And pull the remaining stockinette over the top of the bandages for more security. Perform a few range of motion exercises to loosen the bandages so that you can do your activities of daily living. Remove the bandages in accordance to your lymphedema therapist's recommendation. Please come visit us in the Birmingham area for all of your lymphedema needs.